Welcome back to our YouTube channel. Today we are with Dr. JC Alvarez and we are going to be talking about a very controversial topic. What are the complications after a BBL?
Well, there are many situations where you can have complications. The main ones are infection. That's something that is always on the radar. However, we use antibiotics to try to decrease the amount of bacteria that can complicate the thing. Number two, seromas or accumulation of fluid within the tissues. Unfortunately, in the process of doing liposuction, we're going to separate the skin from the muscle. In between, fluid will collect, the same fluid that collects when you have a blister. That fluid has the characteristic of trying to heal things with growth factors. However, if it accumulates within the tissues, the skin that is detached from the bottom or from the muscle is going to be separated. It's going to have a little cushion that is not allowing it to go to the deeper layer. Removing that fluid is very important. That's why I always use drains. Drains are those little tubes that go within your belly that is going to remove that fluid, allowing that skin to get in contact with the deeper layer, allowing you to have a better outcome. There are some other complications that are more scary. Those are fat embolism. This is when people inject fat in the muscle that can travel through the vessels and land into your lung. That's why we use some measures to prevent it. One, ultrasound to know where the muscle is. However, I have to tell you, when you do reconstructive surgery, you know where that muscle is, especially when the cannula is used. The muscle jumps, and when it jumps, you know that you're in the muscle. It hasn't happened to me, but I'm aware I still use the ultrasound to guide the first layer to prevent that complication. Finally, fibrosis. Fibrosis is scar tissue within the tissues. Remember, when we do the liposuction, we use the cannula that is going to do some friction within the tissues. That friction is like a road rash. It's going to generate a scar. It's very important that you do a lot of massages and compression to try to prevent it. Sometimes the use of carboxy therapy is going to help you. Finally, despite of being sounding very scary, it's less than 1% of the population. We take all the measurements to try to prevent all those complications.